The Omicron wave is largely expected to be our last major battle with COVID-19, and that is perhaps why authorities are working to actively re-establish a sense of normality within the society. For more, I have Dr. Alice Hyung-Dan at Ms. Medi Women's Hospital live on the line. Dr. Dan, welcome back.
Thank you so much for having me.
Also, in the spirit of social distancing, I have Professor Kim Eun-gyu at Yonsei University joining us virtually as well. Professor Kim, it's good to see you.
Thank you for having me.
Dr. Tan, let's start off with your assessment of the latest revision to our pandemic-related guidelines then.
Well, I think the consensus among medical professionals is that the levels of transmission that we have seen recently are not sustainable. And so, in my opinion, I think we really need better management of the transmission levels. And I have five major concerns. First of all, we have 939 ICU beds open around the country right now. But if you consider that we've had 725,000 high-risk cases over the last week alone, and there's a conversion rate to severe disease of 0.6%, if you just do the simple math, we will know that we will be running out of ICU beds pretty soon. And so that's one of my big concerns. The second concern is, of course, the legacy effect of long COVID. We know that it affects multiple symptoms. We don't know how long these symptoms and these systemic conditions will go on for. But we do know that the larger the pool of people who are affected by COVID, the larger the chance that they will have a risk factor for a chronic disease. Right now, we're at 8 million, a little over 8 million cumulative cases. And that's a huge portion of our population. And so I'm concerned that we are perhaps exposing too many people to having risks of long COVID. Also, I'm concerned about whenever you have increased transmission, of course, you have increased risk of the formation of new variants. And that will be a very self-defeating proposition right there, because, of course, if we have a new variant that is perhaps more transmissible or more lethal than previous variants of concern, then we may be right back where we started. And so that's another reason why we want to bring transmission levels lower. Finally, it has come to everyone's attention, of course, that we are seeing so many deaths due to COVID recently that it is becoming difficult for us to bury our dead. And that is such a very heartbreaking situation. Not only is COVID preventing people from having proper burials after the traditional 3-day and night wake, COVID has also prevented the dying from having a proper, warm, comfortable, peaceful dying process where they are able to be surrounded by family, say goodbyes, say thank yous, and have proper closure at the end of life. And so for all of these reasons, I really would like to see transmission levels go down. I think, in my opinion, that we need to do more.
Right. And Professor Kim, based on your observations of the Omicron infection here on the local front, what are your prospects with regard to its spread in the near future?
Total cases of COVID-19 increases by spreading itself and more testing, including asymptomatic patients at school, and using one more method, which is rapid antigen test to count. Now, Korea's 7-day average of cases per population have reached the level of Denmark's peak, which was about 8,000 per million. Denmark has already passed its peak, but I guess we are not yet. And Israel is a country with a highly vaccinated population. Strikingly, Israel's peak was more than 10,000 per million. So if we follow the steps of Israel, it might take 1 or 2 more weeks to reach the peak. New measures to ease social distancing may further increase cases, but I guess with only a minor effect. We are concerned about the peak, the total cases, and severe cases. Which one is most important? My answer is severe cases. We have to give the best protection for people with underlying conditions. And I hope all our resources focused on preventing and treating those severe cases.
Right. And Dr. Dan, authorities have said that the Omicron outbreak here in the local front may be a prolonged affair. Having said that, what preparations do you propose?
Well, first of all businesses, institutions, they need to have a plan B. They need to have a business continuity plan in place just in case there's a large number of employees who become sick with COVID and cannot come into work. We also need to focus on continuing to vaccinate the unvaccinated, boost the undervaccinated, and make sure that all immunized peoples of all ages, including children, have had up to 4 doses. Lastly, I would like to see more effective deployment and use of the potentially life-saving antiviral pill Paxlovid. Right now in Korea, it's indicated for anyone age 40 and above who has a risk factor for severe disease. But I know a lot of people who have had difficulties in accessing this medication. So I think we need to work harder to make sure that anyone who might benefit from this medication has access to it and is able to take it safely.
Right. Professor Kim, you mentioned the rapid antigen tests. What do you believe has been the impact of professionally conducted rapid antigen tests on our containment efforts?
Rapid antigen test is not sensitive in detecting asymptomatic or early symptomatic patients, but we can say we have one more modality to confirm Omicron. As every student at school are tested with rapid antigen test twice or 3 times a week, this will add on new cases. If it is possible, if it is positive with the rapid antigen test, the virus may have already spread throughout the class and family. So it will have limited effect stopping the spread at school.
Dr. Tan, you mentioned Korea's COVID-19 death toll, which remains in the triple digits, and that the number of severe cases, both you and Professor Kim have mentioned, stands well above 1,000. Having said all that, do you believe this reality is well within our medical capacity? And if it's not, is there a way to perhaps bolster it?
Well, we already have 4 cities and provinces that have less or equal to 5 ICU beds left. We have 6 cities and provinces that have 10 or fewer ICU beds left. And so hospital systems are already being very, very strained as it is. And we have to remember that when, the government says that we have secured more ICU beds for the treatment of COVID patients, these beds are not appearing magically. What's happening is beds are being diverted from the care of non-COVID patients to COVID patients. And so basically what that means is many people are having their surgeries, non-urgent or elective surgeries delayed in order to make room for COVID patients. So if we look at the situation holistically, as I said, this is not a sustainable situation. Not only are we going to have a bed shortage soon, but also concerning is a lot of nurses, a lot of doctors as well are also getting sick with COVID. And so we are now faced with staffing shortages. And so this is why I am really calling for better management of transmission levels so that we can get the numbers of patients who are especially at high risk, who are getting newly infected, get this level down. In addition to that, though, we do need to work on being more efficient in terms of our turnover of patients who are in ICU settings, make sure as soon as they are well enough to be stepped down, as we say, they go from ICU to sub-ICU and then from sub-ICUs to the general ward. And from the general ward, if they are well enough and not contagious, perhaps they can be transferred to a skilled nursing facility. And this needs to be on a daily basis, maybe every 8 hours, so 3 times a day. Bed availability and transfer of patients need to be done on a very, very efficient way.
Right. And back on the testing front, Professor Kim, some people have reportedly been shying away from COVID-19 testings despite having symptoms. Is there a way to address this particular problem in your view?
Oh, we cannot force everybody to test. Before the Omicron outbreak, most of the patients were willing to have PCR test. But now I can easily find someone who is not willing to. There are some reasons that we don't know why they are refusing. But if you have admit to hospital, it is mandatory. And if you live with someone who have underlying condition, testing and quarantine is mandatory. If you are planning to have a close contact with somebody chronically ill or not vaccinated, and you have minor symptoms and not tested, it is wise to cancel it. And you better get tested with accurate methods like PCR. If you work at the hospital or nursing homes, you better follow strict testing rules, as we are seeing hundreds of mortality nowadays.
Right. And Dr. Tan, some studies appear to cast doubt on the policy of a 7-day quarantine timeframe for COVID-19 patients. What are your thoughts?
Well, as was mentioned earlier in the program, research was done here in Korea where they looked for a culture of viable virus from people at various stages of infection. And what they found was even on day 8, they were able to culture viable virus, but the amounts were very, very low. And the opinion was that it would be very unlikely that a person would be infectious beyond day 8 or beyond day 7 of infection. And so I don't think we need to prolong the isolation period. I think from day 1 to day 7, we assume that a person is infectious. Of course, if a patient continues to have symptoms, then also they may be infectious. But beyond day 8, the recommendation is to wear a mask and be very, very careful, avoid any high-risk areas such as nursing homes and hospitals. But I do not think we need to prolong the period of isolation beyond 7 days.
Right, and staying with those studies, Professor Kim, others reportedly show that fully vaccinated people are less likely to pass on COVID-19 to those around them. Over 86%, that is, of the people here in Korea, Professor Kim, are fully vaccinated and almost 63% are boosted. But still, we are recording 6-digit daily tallies. How do you interpret this reality?
Current vaccines are designed for original Wuhan strain. And for Omicron, vaccinees may spread less than unvaccinated, but Omicron is highly contagious. It is not as the original Wuhan strain. It is much more contagious. So it is spreading like a wildfire. If we were not vaccinated, it would have been more devastating. So when you look back, Korea did well on quarantine for the last 2 years. But immunity by natural infection was very low since recently. This might be another reason why Omicron outbreak is much worse compared to other Western countries.
Dr. Tan, I understand this next question may be premature, especially given the current situation here on the local front. But when do you suppose can we declare an end to the pandemic here and perhaps the start of an endemic phase, which would no doubt entail very significant, very different containment strategies, that is, including the lifting of mandatory quarantine?
Well, if we look at the pandemic from a global perspective, I unfortunately, I hate to be the bearer of bad news, but I don't think that the end of the pandemic is near. And the reason why I say that is because we obviously have geopolitical conflict regions where the pandemic is raging and there is not a lot of monitoring. And there's, of course, not infectious disease prevention and control, right? That right now is just a matter of surviving a war. And then, of course, we have many regions around the world where vaccination rates are not high. And so those are the two reasons why I don't think the end of the pandemic is really any time near. However, that doesn't mean that we shouldn't start planning for brighter days. And once we see lower transmission levels, of course, in our acute sort of crisis that we're in right now, we really need to look out for test positivity rates. Right now, they are exceedingly high. And until these positivity rates go down, I don't think we're going to see significant decreases in the daily case counts. But one day, we will get over the Omicron wave, just as every country has. What we need to do, though, is continue to monitor, especially genetic surveillance, to make sure that we can catch the new variant of concern early and have a plan in place for what to do. And as was mentioned previously in your broadcast, perhaps if we institute wastewater surveillance, that may also help as a way of gauging where we are in the pandemic and catch outbreaks sooner than just waiting for people to come in to get tested if they have symptoms.
Right. And staying with premature questions, Professor Kim, this is an impromptu question. The World Health Organization has said it is too early to declare an end to the pandemic, but officials there are looking into the criteria needed to declare an end to the pandemic. Having said that, what do you believe should be included in that particular criteria? When can we say that the pandemic is officially over and we are entering an endemic state?
Before we want to say it is the end of pandemic, we have to look back on the world map one more time. And as I said many times, there are so many blind spots in our world map. And as you can know, two of the major mutants of COVID-19 came out of Africa. And well, I guess at least 20% of the world population is located there, but the vaccine rate is very low. And most of the higher income countries already have third shots and even planning for the fourth. But we don't know whether we might have another mutant coming out of Africa. So we should not have a blind spot in the world map first. And I wish that we are more concerned about our neighbors, especially located in lower or middle income countries. And that is one of the preconditions that we can say this is the end of the pandemic.
Right. And Dr. Dan, this is also another impromptu question for you. You mentioned long COVID as we started this particular discussion on this Friday. And keeping that in mind, there are some doctors here in the country, Dr. Dan, who claim that you might need to take an X-ray of your lungs after you recover from COVID-19, regardless of whether you were asymptomatic or had severe symptoms. Could you explain that recommendation for us?
Well, in general, if you've had symptoms for more than 4 weeks, that's when we recommend that you go into a clinic and have a full checkup, and a chest X-ray would be included in that. There are some concerns that, as I mentioned, with long COVID, even people who are asymptomatic with the initial infection, they can develop shortness of breath, they can develop heart conditions, chronic lung disease. And so that's why it's a good idea just to get a chest X-ray. Some doctors are recommending to just screen for fibrosis, for signs of residual pneumonia, anything that could lead to a potentially more severe condition. I think this would apply for people who are at high risk of having pneumonia and severe lung disease, certainly the elderly and anyone who's been hospitalized. I would recommend getting a follow-up chest X-ray 1 month after the acute illness.
Right. And Professor Kim, for the sake of our viewers here, amid the transition from winter to spring, do remind us about the symptoms of Omicron as compared to those of the common seasonal allergies.
Omicron is almost indistinguishable from seasonal flu, but if I compare with allergic rhinitis, allergic fever, and the main symptoms are sneezing, nasal obstruction, and itchy sensation on nose or eyes. Sometimes it's seasonal, sometimes it's non-seasonal, and you might have a known allergen, but many times you don't know causing it. mild allergic rhinitis may not have higher risk for Omicron infection, but severe and chronic allergic rhinitis usually have a weak mucosa and have chronic inflammation. They have a higher risk for various pathogens, including Omicron.
I see.
So if you already have a allergic rhinitis, you don't have to worry. But if the doctor says you should be careful, then you better take care not getting any kind of infection.
Right, so it is best to get the advice of your doctor as well, because there's been a slight disruption in the audio with your connection, Professor Kim. Dr. Dan, one final question to you before we say goodbye today. I was wondering, children aged 5 to 11 are starting their vaccinations late this month here in the country. What are your words of advice, very briefly speaking?
Well, we're seeing so many tens of thousands of children getting infected on a daily basis, and it's really disrupting their education. So my recommendation is for the high-risk children, definitely they should get vaccinated. For the healthy children, of course, they need to have a discussion with their pediatrician. But as a mom, as a doctor, as someone who has 3 children, I actually recommend vaccination. I think that's one of the ways that it could end this Omicron surge that we're experiencing here in Korea.
All right, Dr. Dan, as always, thank you very much for your words. Professor Kim, thank you very much for your insights today.
Thank you.